Welcome to Indiana Newsdesk. I'm Joe Wren. Indiana House leaders said yesterday they'll try to extend needle exchange programs for 1 year after the state Senate failed to pass a bill that would have removed the sunset date for the programs. Reporter Mitch Legan is with us now. He traveled down to Scott County where contaminated needles led to an HIV outbreak in 2015.
Yeah, Joe, the CDC says Indiana has 10 counties that are vulnerable to an HIV outbreak due to injection drug use, while 9 counties run syringe service programs. So health officials down there are really hoping lawmakers see the value in these programs.
Michelle Matern has spent the last 3.5 years as Scott County's health administrator working to prevent another HIV outbreak like the one 5 years ago.
About 95% of the cases were also co-infected with hepatitis C. And so all those cases back then were linked to injection drug use, sharing syringes with each other.
The epicenter of the outbreak was Austin, where the number of positive cases made its HIV infection rate comparable to sub-Saharan Africa. As the crisis in Scott County spiraled out of control, then Indiana Governor Mike Pence signed an executive order allowing the county to operate a needle exchange program.
I will tell you that I do not support needle exchange as anti-drug policy, but this is a public health emergency. And I'm evaluating all of the issues and all of the tools that may be available to local health officials in light of a public health emergency.
We're expected to have around 25 new HIV cases every year just based on our population size and the number of positive cases that live in our county. And the most we've seen in the last 3 years is 12 cases. Last year, I believe we had 7. So every year, we're trending downward.
Matern credits the county's needle exchange for the drop in cases. Since Scott County started its exchange, 8 other counties have followed suit. But their existence is now in jeopardy. The bill that allowed counties to start exchanges expires next summer, and if lawmakers don't update the language, the programs could go away.
It was intended to be an exchange. It became a giveaway program in which hundreds of syringes were being given away at any given time, at any given location, at multiple locations.
Grooms voted against the bill that would have extended the expiration of the exchanges. Clark County felt the effects of the HIV outbreak. Scott County residents came here in droves for treatment. Eric Yazel was an emergency room doctor at the time.
In 2015, if you came in and told me that, I'm using heroin and I need some help, I'd hand you a paper that had a phone number on it for a place that had a couple-month wait, and that's literally all that we had to offer.
Clark County also established a syringe service program, and Yazel says it's seen its overdose deaths fall by 50%.
You use things repeatedly, it lets bacteria out in your bloodstream, and you get infections of your spine and heart valves and things like that. So we have different needles here, and we have other products that, typically would be used over and over again when someone's using IV drugs.
Back in Scott County, users can visit the health department's one-stop shop in Austin for clean syringes. But Matern says most importantly, it provides health care for those who need it.
We have peer recovery coaches that work in our syringe service program that have, like I said, are in recovery themselves, and so it gives them a peer to talk to and walk them through that process whenever they are ready to be off substances and go into recovery. So it's not just exchanging physical supplies, but it's an access point that is compassionate and caring.
She says part of the difficulty surrounding needle exchanges is the stigma they carry as a sort of starter kit for drug users.
And that whole word that's often used, and we still hear that even within the policy arena, is you're enabling the drug use. And I think over time I've come to really see how it truly is a prevention and evidence-based public health measure.
Research from the Centers for Disease Control and Prevention shows needle exchanges help reduce the spread of infectious diseases like HIV and can help people overcome substance abuse.
People will still continue to use just because there aren't clean syringes available. They will go back to using and sharing dirty syringes. And so we're going to see disease spread again. It may not be the first year, it may not be the second year, but eventually we're going to see the increase of disease start again, and we're going to find out again that it's all through injection drug use. So back to square one.
And as we said, Indiana House leaders will try to extend the needle exchange programs by at least 1 year, but Matern and Yazel say educating the public and lawmakers about the usefulness of the exchanges is paramount to their success.
All right, Mitch, thank you very much.
Thank you, Joe.